bet if you're dealing with sciatica, you're frustrated and feel like you've wasted so much time fighting sciatica, taking various medications, getting injections, trying different exercises, and following your doctor's orders. But your pain at best is temporarily alleviated. But what happens when you go for a car ride, try going for a walk with your dog or a loved one, or try just doing something you love? It keeps coming back, doesn't it? So in this video, what I'm going to do is go over why this happens, why your sciatica lasts so long, and at the end of the video, I'm going to tell you what you can do to start getting on the road to recovery and fixing your sciatica. By the way, my name is Dean Volk, and I've been a physical therapist for over 32 years, and for the last 16 years, I've focused specifically on sciatica, helping thousands of people start living pain-free again. Number one, the reason why your sciatica lasts so long and the reason it's not going away like you would like is you are getting the wrong treatments. And when you get the wrong treatments for a problem, you get the wrong results. For example, if you start getting a sore throat and start taking some Tylenol to try to calm down the pain and the irritation, you know what? You may get some temporary relief until you find out, you know what? I've got strep throat. So even though you're taking a pain medication for a problem, you're not taking the right medication that's going to alleviate the pain for any length of time. So in the same way that taking Tylenol for strep throat won't take your pain away permanently and fix the problem, doing the wrong exercises, taking the wrong medications, not getting to the root cause of the problem and fixing what's going on in your body the right way, the wrong treatments will lead to longer lasting sciatica and a lack of results. I hope that makes sense. In the same way that you need the antibiotic in order to knock out the strep throat, you need to be taking the right approach and doing the right things to calm down your sciatica and heal for good. Number two, so many of my clients come to me, they're going to a chiropractor, a massage therapist, taking physical therapy, and maybe even doing yoga or Pilates on the side or acupuncture. They're trying everything they can, and I get it. I totally understand why you would want to be doing everything you possibly can to try to eliminate the sciatica. But here's the problem. If you're doing really more than one thing, let's say you're going to a chiropractor and a physical therapist, do you have any idea which one is possibly aggravating your symptoms further or keeping you in pain, and which one may be actually helping? Maybe they're both helping and you're getting slightly better. Maybe they're both not helping and you're getting worse. I always try to encourage my clients, hey, try one thing at a time. If it's working, great. Then add something else if it's not getting you the results as fast or as complete as you want them. It's always easy to add or subtract something, but if you're doing so many things at once that you can't recognize what is helping and what is hurting, it's going to be really tough for you to know what to keep doing and what to eliminate. I hope that makes sense. I'm not here knocking physical therapists, chiropractors, doctors, acupuncturists, Pilates, or any of these people. Being a physical therapist, I'm a little biased, but I do know that we can't help everybody all the time, and there's other things out there that work. But please make sure, I usually tell people, if after 3 to 5 sessions, you are not noticing a decreasing in symptoms or a delayed onset or some type of change, it may be time to change the approach because what you're doing is not really working. And that goes for people who have been dealing with sciatica for 6 weeks up to 63 years. And that's about the range that I have seen clients and have helped clients in. I hope that makes sense. Number 3, most people are depending on medications, injections, or radiofrequency ablations to minimize their pain, keep it at a level that is tolerable, but the symptoms don't go away. Now, here is my concern and my problem with that approach. Medications, radiofrequency ablations, and injections are great to calm down the symptoms. Oftentimes, they're great to calm down the symptoms. Some people, it actually aggravates their symptoms. But here's what I tell people. If you are getting relief or if your symptoms are calming down, just realize that those things are masking what's really going on. It's sort of like having a toothache, getting some Novocaine in your jaw or in your gums. The pain from the tooth problem is gone, but that doesn't mean anything with that tooth has changed. And you can go on eating, if you can, with a numb mouth and doing things that you normally would be doing without feeling the pain, but you're not doing that tooth any favors, and you're probably aggravating it further. Say you had a crack in the tooth and you're taking strong pain medications, and somebody gives you an injection of Novocaine or lidocaine or something to mask that symptom. You can go on with life as if nothing's really a problem because you don't feel it, but that crack in the tooth isn't going to get better until you get it addressed correctly. If you have sciatica and your symptoms are minimized by medications, injections, radiofrequency ablation, if you go about your business and your daily activities normally without being cautious and without avoiding those things that typically caused pain, you're probably aggravating the problem even more and more without realizing it because the symptoms are masked. So I try to tell my clients, think of your sciatica, piriformis syndrome, or whatever is underlying the sciatica problem as a wound that needs to be healed. You don't need to be stretching on it, digging on it, and doing things that typically would aggravate it while your symptoms are minimized and masked by medications. Number 4, I always tell people, if you're using generic exercises online, or if your therapist, chiropractor, doctor, whoever hands you a sheet of exercises before testing you in all your movements and all your movement biases and just hands you a generic sciatica exercise sheet, please be cautious because those have nothing to do with your specific condition. And they're sort of ingrained in us as professionals that, hey, these are the exercises that help sciatica. And over the first 15 to 16 years of my career, I did the same thing because that's how we were trained in school by all the back and sciatica gurus. The problem is not everybody responds to the press ups or leaning into the wall or doing the bridging or doing the figure 4 stretches or hamstring stretches or nerve flossing or gliding the same. Everybody is unique in the way they respond to pain. And if you're not getting exercises specific for your condition and your body and the way you respond to pain, the exercises probably will do more harm than good. Everybody has movement biases in their body that feel good to them, or some people prefer bending forward versus extending backwards. And most exercises and generic exercises don't take into account movement biases, and you're doing things where you're pulling both knees to your chest, as well as doing extension exercises. So you're doing both flexion and extension exercises, and one of those two are probably going to aggravate you and negate the benefit that you're getting from the opposite motion. I hope that makes sense. Number 5, I often tell my clients, you are going to have to become an expert in knowing what movements, positions, and activities trigger your pain. Because so many times we do things that aggravate the problem that might even feel good while you're doing it, but later on there's a delayed onset, or there could be an immediate onset of pain. So you need to become familiar with what triggers, meaning what movements, activities, or positions aggravate your symptoms, because you want to do as minimal as possible those things that trigger your pain. At the same time, there could be positive triggers. What are those movement, positions, and activities that decrease my pain, that cause my body to relax, that ease the tension in my body? The more positive triggers you have, the better off you're going to be. And the more positive triggers that you do, way better than doing those things that negate and harm you and trigger you in the wrong way. You wouldn't take an open wound on your arm and pull on it, dig on it, stretch it, try to get it to calm down by aggravating it further. In the same way, you don't want to do that to your sciatica. You don't want to be stretching and digging on the areas of pain, because when something is already aggravated and irritated, digging on it, stretching on it, pulling on it, trying to strengthen it is just going to aggravate it further. Number 6, you've not been taught how to balance out your body. And what do I mean by that? I'm not talking about balance as in being able to stand on one foot or close your eyes and stand on something that's soft and makes your body wave. I'm talking about balancing out the imbalances in your body that are caused by the way your body compensates for pain. Because what happens is when you have pain, whether it be one side, both sides, doesn't matter whether it's one-sided or both-sided, whether it goes all the way down your leg, whether it stays in your low back and shoots into your butt, or just to your hamstring, or just in your calf. It can be anything along that entire area. It can be one spot, it could be two spots, it can be the entire thing. When your body has pain, the body's natural response is to tense up, especially around the area where the actual problem is, to try to protect any further damage. And in order for you to function, your body's going to compensate. And I always use this example. Think of somebody walking around on a bad sprained ankle. Their head, neck, and shoulders are doing this, all because the problem is down low in their ankle. And what happens is the muscles around the ankle are tightening and protecting the area so no further damage occurs. Your body continues to function, but it has to compensate for what the foot, the ankle, and those muscles are no longer doing. And your body is a master at compensating in order to keep you functioning with as minimal pain as possible. And some of you are going, Dean, there is no minimal pain. But trust me, if your body wasn't compensating, tightening around the area that's problematic to try to help stabilize it, with all the other muscles in the body pulling in different ways from the norm, you would be in much more pain. So what I do is I teach my clients, hey, we need to balance out all these imbalances in your body, because what happens is when you compensate and you have these imbalances, that adds extra tension in your body, extra physical tension, muscular tension that causes the area around the problem to tighten down even more to protect itself from all that extra tension on top of the pain that you're already having. So by balancing out your body, what that's going to do is minimize the tension in your body, take pressure off the area that's problematic, allow the muscles that are protecting the area to relax a little bit to get more nerve conduction, more normal nerve conduction, blood flow to the area to bring oxygen into the area in order to help promote healing, and also decrease tension all around the area that's affected, which will decrease pain overall. Basically, I offer people, and what I teach people and what you should do is find somebody in your area who can do this. My simple 3-step plan that I help people in order to alleviate their sciatica pain, but also promote healing in their body. Number one, I want to balance out those imbalances in your body. And people are shocked when their body starts getting more balanced, their symptoms calm down, the onset of pain is delayed, the intensity of the pain decreases. And then once we get your body balanced out and anywhere from 60 to 80% less pain, what we do is then we start stabilizing, because we want to stabilize your body in a balanced position, not in a compensated position. And if you start the core strengthening and the gluteal strengthening exercises prematurely, you're basically re-emphasizing all the compensations and all the muscular imbalances. And you don't want to reinforce that, because you don't want to have to break those imbalances once they're locked in from being stable in that position. Then once you're balanced and stable, then we get you back to doing what feels good and doing those things that you love slowly and wisely. I've helped over 1,879 clients with sciatica over the past couple of years. And I've actually made a video going over the 10 things that I've learned from those clients. So if you've watched this far, number one, thank you. But you should also definitely check out the video that's on the screen now.